Anatomical language. Do you ever feel like you're lost in a maze of human anatomy? Trying to decode an anatomical language without a dictionary? If you're like me, figuring cranial from caudal or ventral from dorsal is a very dangerous game, because before you know it, you look more like you're trying to learn the Macarena rather than trying to learn anatomy. Studying human anatomy involves naming and describing thousands of structures and describing their relative position to each other. And unfortunately, saying something is on top of or beside something else just doesn't cut it. Students, clinicians, and anatomists alike rely on a more specific and precise language to describe these relations. But fear not! Today, we're giving you the ultimate arsenal of terms to navigate this. Say goodbye to the Macarena and hello to confident anatomical orientation. Let's learn about the directional terms and body planes of anatomy. When we talk about our bodies in anatomy, we always refer to a standard pose called the anatomical position. It's like the blueprint for describing our body parts, regardless of how the body is positioned in real life. In the anatomical position, we always consider the person as standing upright, looking forward, with arms to the side, palms facing forward, and thumbs pointing away from the body. The feet are slightly apart and parallel to each other, with the toes pointing forward. Let's get straight to the directional terms that help us in describing the location of body parts or structures. The first pair of terms that you need to know is anterior and posterior. Anterior indicates that the body part in question is in front of or front. Posterior indicates that it is behind of or behind. For example, your toes are anterior to your heels, and your heel is posterior to your toes. The next pair of terms are ventral and dorsal. Ventral indicates something is towards the front of the body, and dorsal means towards the back of the body. Ventral comes from the Latin word venter, which means belly. So ventral literally means towards the belly, which is towards the front of the body. Dorsal comes from the Latin word dorsum, which means back. So for example, the kneecap is located on the ventral side of the knee joint, while the popliteal fossa is located on the dorsal aspect. Our next directional terms are right and left, which, lucky for us, is quite straightforward. Well, kind of. Just remember that when thinking about left and right, you always have to think of it in the anatomical position, not the position of something when you're looking at it on a screen or in a book. So this is the right lower limb, and this is the left lower limb. Next in our arsenal of terms are proximal and distal. Distal means that it is away or distant from the trunk or the point of origin of a certain structure. Proximal means that it is closer or in proximity to the trunk or point of origin. So we can say that the elbow joint is proximal to the wrist joint and the fingers are distal to it. Now if we split the body in half this way to equal left and right parts, the line down the middle of the body is called the median or midline. This is key in understanding the directional terms, medial and lateral. Medial means towards the median or towards the midline of the body. Then lateral means away from the median. So we can say that your nose is medial to your eyes because it's closer to the midline, while your ears are lateral to them. Superior means above or upwards. And of course, if there's an up, we must also have a down. And the term we're looking for in this case is inferior. Inferior indicates below or downwards. So for example, the nose is superior to the mouth while the chin is inferior to it. You'll also sometimes see the terms cranial and caudal instead of superior and inferior. They literally mean towards the cranium or head and towards the tail or coccyx, respectively. You may often also see the term superior converted into the prefix supra, as in the supraclavicular lymph nodes, which are located superior to the clavicle. And you may also see inferior as the prefixes such as infra. For example, the infraorbital artery is located inferior to the orbit. Two other prefixes similar to infra are hypo or sub, both of which mean under. The hypoglossal nerve is inferior to or under the tongue, and the submandibular lymph nodes are located beneath the mandible. Two additional pairs of terms which we need to look at now are superficial and deep, as well as external and internal. These are kind of related to each other, however are not completely interchangeable. Superficial and deep refer to position relative to the surface of something, usually the skin, for example. For example, the superficial gluteal muscles and the deep gluteal muscles. External and internal, sometimes also called outer and inner, describe whether something is located on the outside or inside of something. For example, the stomach has an external surface and an internal surface. Now that we've learned about the major directional terms, it's important to note that using one directional term is often not enough to describe the location of a structure in relation to another. Fortunately, we can combine them to give a more accurate description of anatomical structures. The liver is located below the heart and away from the midline, so we can describe that as infrolateral. To combine the two directional terms, we usually abbreviate the first term, like in this list, and then add it to the second term. Now let's take a few moments to discuss some regional directional terms, which are specific to certain parts of the body. Let's begin with the brain. Now we came across some of these terms earlier on, but in the brain they have different meanings, which can be confusing. In the cerebrum, we sometimes use the term rostral instead of anterior. Rostrum comes from the Latin word for nose or beak, so think of this term as anything pointing anterior towards the nose. The term caudal in the brain means the opposite of rostral and can be used instead of posterior when describing structures of the cerebrum. When describing the inferior aspect of the cerebrum, we use the term ventral, while the superior aspect is referred to as the dorsal aspect. Moving down to the brainstem, we can see here the anterior, posterior, superior, and inferior directions to orientate ourselves. As with the rest of the body, the anterior and posterior aspects of the brainstem may also be referred to as the ventral and dorsal aspects respectively, while the superior and inferior aspects can be called cranial and caudal. Moving further down to the hand, the anterior aspect is often referred to as the palmar or volar aspect of the hand, while the posterior aspect or back of the hand is referred to as the dorsal aspect. The thumb is on the lateral or radial aspect of the hand, while the little finger is on the medial or ulnar aspect. We're going to move on now to the feet. The underside or sole of your foot is known as the plantar aspect of the foot. To help remember this term, think of your feet as being firmly planted on the ground. On the opposite side, we have the dorsum of the foot, which is the area facing upwards while standing. This can be a little confusing because, as we've already seen, dorsal typically means towards the back. You can blame embryology for this one. Now, to further help us navigate the human body, we also have anatomical planes and axes that serve as reference points for anatomical descriptions and movements. Body planes are imaginary planes that slice or section the body in its anatomical position. Try not to get too spooked out here, but if we were to slice the body vertically, we would get an anterior part and a posterior part. This is called the coronal or frontal plane. Now, the word coronal is derived from the Latin word corona, which means relating to a crown or coronation. So imagine a king or queen who wears a crown that is slightly too sharp and splits their body into two. Then we have the sagittal plane. It is also a vertical plane, but it splits the body into unequal left and right parts. A sagittal plane that runs directly through the midline of the body is called the median or mid-sagittal plane. As you can see, it divides the body into equal left and right halves. Next, we have the transverse plane, which is a horizontal plane that divides the body into superior and inferior portions. We also sometimes refer to this as a cross-section. In addition to anatomical planes, we also have anatomical axes. These are straight imaginary lines that run through the body along three directions. We have the horizontal axis, also known as the mediolateral or x-axis, which passes from left to right and is formed by the intersection of the coronal and transverse planes. The vertical axis, also known as the longitudinal or y-axis, and this axis passes inferior to superior, and is formed by the intersection of the sagittal and coronal planes. And the sagittal axis, known as the antero-posterior or z-axis, passes from anterior to posterior and is formed by the intersection of the sagittal and transverse planes. These axes are usually used to describe a line around which a body part rotates, typically the movement around a joint. For example, the elbow joint sees the movements of flexion and extension occurring around a horizontal axis in the sagittal plane. And that's it! Today we managed to take a quick look at the arsenal of terms we need to orientate ourselves and navigate the human body. Farewell, Macarena. Hello, Mastery of Anatomical Orientation. See you next time.
Coronalis. Sagittalis. Transversus. Medianus. Superior. coronalis,
inferior,
sagittalis, transversus, medianus,
superior,
medialis, medianus,
inferior,
lateralis, sinister, dexter, cranialis, caudalis, medianus, rostralis, Caudalis. Proximalis.
Have you ever had a sharp pain in your lower right belly, rushed to the doctor, and found they started pressing around your abdomen? They were probably checking for appendicitis, specifically at McBurney's point, the surface spot which the appendix lies beneath. That's a great example of body surface anatomy, where we use visible or touchable landmarks on the body to figure out what's underneath. It's essential for clinical practice for examining, describing, and interpreting the location and relationships of anatomical structures, and it also helps in reading medical images accurately. In today's tutorial, we'll explore the anterior and posterior surface anatomy of the head, neck, and trunk, otherwise known as the axial body, plus the upper and lower limbs, also known as the appendicular body. Across these regions, we will identify 3 types of surface landmarks: bony landmarks, soft tissue landmarks, and external organs. Let's begin by looking at the surface anatomy of the anterior surface of the axial body, or in other words, the front of the torso. Our first landmark is the larynx, or voice box, located in the neck over the esophagus at the level of cervical vertebrae 3 to 6. The larynx contains vocal cords and helps produce sound as well as conduct air to the lungs. The thyroid cartilage of the larynx forms the laryngeal prominence, commonly called the Adam's apple. To feel your larynx, simply find your Adam's apple. On each side of the larynx lie the large sternocleidomastoid muscles. These muscles originate from the sternum and clavicle and insert on the skull. When you turn your head, these muscles form sharp ridges that create a slight V shape and are easy to palpate. The clavicle, also known as the collarbone, is a thin S-shaped bone connecting the upper limb to the trunk. You can easily spot it by taking a deep breath and raising your shoulders. Just above the clavicle, between the sternocleidomastoid and deltoid muscles, is the shallow supraclavicular fossa. It extends from the sternal end of the sternocleidomastoid muscle to the medial edge of the deltoid muscle. Moving to the chest, the sternum is a flat bone consisting of 3 parts: the manubrium, body, and xiphoid process. The manubrium lies between the clavicles and features the jugular notch at its superior border. The junction between the manubrium and the body of the sternum forms the sternal angle, which aligns with the second rib and can be felt just below the jugular notch. The body of the sternum articulates with ribs 2 to 7, while the small pointed xiphoid process forms its inferior tip and can be felt at the base of the chest. Lateral to the sternum, beneath the breast, lies the pectoralis major muscle, a large superficial chest muscle. Both males and females have breasts, composed of fat, mammary tissue, and skin. At the centre of the breast is the nipple. The pigmented area around the nipple is called the areola. At the lower edge of the rib cage is the costal margin, formed by the cartilages of rib 7 to 10. This becomes more prominent when you exhale sharply. Next is the rectus abdominis muscle, or abs, running from the pelvic bone to the xiphoid process and lower ribs, giving the abdomen its characteristic six-pack appearance. Down the middle of this muscle runs the linea alba, a fibrous band separating the left and right rectus abdominis muscles. On the sides, the semilunar line, or the linea semilunaris, is a curved tendinous band that runs along the lateral border of the rectus abdominis. It marks the lateral margin of the rectus sheath and extends from the ninth rib cartilage to the pubic tubercle. The umbilicus, commonly known as the navel or belly button, marks the scar of the fetal umbilical cord attachment and is easy to spot. Below that are the anterior superior iliac spines, bony projections of the pelvic bones that you can feel by placing your hands on your hips and sliding your fingers forward. The inguinal ligament extends from the anterior superior iliac spines to the pubic tubercle and can be palpated along this line. In females, the mons pubis is a fatty area over the pubic symphysis, covered in hair post-puberty. It's part of the vulva, which includes all external female genitalia. In males, the penis is an external reproductive and urinary organ, ending in the glans penis, covered by the prepuce of the penis, more commonly known as the foreskin. Just behind it is the scrotum, a sac of skin and fascia housing the testes, the epididymis, and spermatic cord. Let's move on now to talk about the posterior surface of the axial body, or in other words, the back of the torso. At the back of the head is the external occipital protuberance, a bony bump. Just below, the C7 vertebra stands out with the longest spinous process, easily felt when you bend your neck forward. Covering the back of the neck and upper back is the trapezius muscle, a large diamond-shaped muscle you can easily palpate. The scapula, commonly known as the shoulder blade, is a paired bone with three palpable landmarks. The spine of the scapula, which is a protruding ridge that divides the bone into the superior supraspinous fossa and the inferior infraspinous fossa. The medial border, which runs parallel to the vertebral column, and the inferior angle at its bottom tip. Below the scapula lies the large latissimus dorsi muscle, which helps pull the arms down and back. Its lower border runs near the iliac crest, the top edge of the pelvic bone, palpable at the lower back. Between these landmarks lies the lumbar triangle, bordered by the iliac crest, latissimus dorsi, and external oblique muscles. The posterior superior iliac spines mark the back ends of the iliac crests and can be identified by the dimples of Venus. Between them lies the sacral triangle, overlying the sacrum and sacroiliac joints. The sacroiliac joint is the articulation between the sacrum and the ilium, and it supports the weight of the upper body. At the lowest point is the anal region, including the anal canal and sphincters, located just in front of the coccyx. Now that we've finished with the surface anatomy of the axial body, let's move on and have a look at the surface anatomy of the limbs, beginning with the anterior aspect of the upper limb. The upper limb connects the trunk where the clavicle meets the acromion of the scapula, a bony point easy to feel on the shoulder. This connection is otherwise known as the acromioclavicular joint. The shoulder surface is mostly formed by the deltoid muscle, a rounded cap over the lateral arm. On the front of the arm is the biceps brachii muscle, a major flexor you can feel when you bend your elbow. At the elbow crease lies the cubital fossa, a triangular hollow containing important nerves as well as vessels, such as the brachial artery and veins. The palm has two soft tissue prominences, the thenar eminence at the thumb's base and the smaller hypothenar eminence at the base of the little finger. Let's move on now to the posterior aspect of the upper limb. The triceps brachii muscle is found on the posterior aspect of the arm. It's a large three-headed muscle whose tendon inserts onto the olecranon, the bony tip of the elbow. Moving down the arm, on the back of the wrist, is the radial foveola, a hollow visible when you extend and abduct the thumb. It's commonly known as the anatomical snuff box, after the historical practice of placing ground tobacco, otherwise known as snuff, into the depression and then inhaling it through the nose. Next, let's move down the body to look at the surface anatomy of the lower limb, starting with the anterior aspect. On the anterior thigh are the quadriceps muscles, a group of 4 large muscles that flex the hip and extend the knee. Near the groin is the femoral triangle, a small area inferior to the inguinal ligament containing major blood vessels. At the front of the knee is the patella, which is otherwise known as the kneecap. The patella is the largest sesamoid bone. And just below the patella is the tibial tuberosity, a bony bump on the anterior aspect of the tibia. The tibialis anterior muscle runs down the front of the leg and shapes the shin. This muscle aids in forming the shape of the anterior surface of the leg. At the ankle are 2 bony landmarks, the medial malleolus, which is found on the inner ankle, and the lateral malleolus, which is found on the outer ankle. Switching up to the posterior side of the lower limbs now, let's take a look at the gluteal region, commonly known as the buttocks. The gluteal region is shaped by the 3 gluteal muscles, especially the gluteus maximus. The region is separated by the intergluteal cleft, or, as you might more commonly know it as, the butt crack. The crease below the buttocks is known as the gluteal sulcus. It's important to note, however, that the gluteal sulcus is a skin fold and not a muscle border. On the outer thigh runs the iliotibial tract, a thick band of fascia that stabilizes the hip. The back of the thigh contains the hamstring muscles, which include the biceps femoris, semitendinosus, and semimembranosus, whose tendons are palpable behind the knee. Below is the popliteal fossa, a diamond-shaped hollow behind the knee with important nerves and vessels such as the popliteal artery and vein, and the tibial and common fibular nerves. The triceps surae muscles, made up of the gastrocnemius and soleus, form the calf. Their tendons merge into the strong calcaneal tendon, commonly known as the Achilles heel. The calcaneal tendon attaches to the heel bone. Before we finish this tutorial, let's go over a quick clinical note. Remember McBurney's point, the approximate surface location of the appendix? If you're in hospital and the doctors want to find it, they might draw a line from the umbilicus to the anterior superior iliac spine. The appendix lies at the junction of the lateral and middle thirds of this line, so tenderness here may suggest appendicitis, signalling the need for further medical evaluation. And with that, we've explored the surface anatomy of the human body. Hopefully you've learned enough so that next time you're at the doctor poking around that sore spot on your belly, you'll know exactly what they're checking for. Don't forget to learn more about this topic and consolidate your knowledge with our articles and quizzes at KenHub. See you next time!
Learning a new language may initially seem like a daunting task. As beginners, we need to start by learning a few simple rules and basic words which form the foundations of a new language. When this base is strong and without cracks, we can slowly build our knowledge. Much like learning a language, learning anatomy also requires strong foundations. Advancing in anatomy isn't possible without first conquering the anatomical alphabet. Today we're learning about one of the building blocks in the language of anatomy. Welcome to this short and sweet tutorial on the regions of the body. Before we start, let's take a quick look at what we'll cover in this video. We'll start with answering the question, what is a region of the body? And the relevance of a regional anatomy approach. Then we're going to look at the two main anatomical divisions of the body, starting with the axial region, followed by the appendicular region. As we go through, we will also take a look at the major divisions of each of these regions. And finally, we'll talk about the relevance of these topics in clinical practice. But first things first, what is a region of the body or an anatomical region? It's an area of the body defined by landmarks provided by evident structures that are easily palpable or visible. To put it simply, it is a part of the body that, because of its shape and form, easily stands out as distinct from the other regions. These shapes are created by various structures found underneath the skin, such as bones, muscles, or ligaments. Just like a map, a region of the body refers to a certain distinct area. You can think of the body as a country and the regions of the body as districts. This approach to the study of the human body is called regional anatomy. You might be wondering, why do we need to split up the body into anatomical regions? This is essentially a way of compartmentalizing the body so it is easier to learn the overwhelming amount of information available regarding its anatomy. And these concepts are also fundamental to communicate effectively in day-to-day clinical practice. In this tutorial, we will use images of both male and female individuals to demonstrate the regions in question. However, it is important to note that for the most part, the regions are exactly the same and are not sex-specific. Broadly speaking, the body can be divided into two primary areas: the axial and the appendicular regions. The axial region consists of the head, neck, and trunk. And the appendicular region is composed of the upper and lower limbs or extremities. Both the axial and appendicular regions encompass an anterior and a posterior surface. Now that we understand the definition of region and the necessity to divide the body into regions, let's begin with the axial region. Axial comes from the word axis. So basically, axial refers to parts of the body that are at the center, around which something is arranged, in this case, the limbs. And as I mentioned before, the axial region includes the head, neck, and trunk. Going from top to bottom, we'll start with the head. The head is the most superior part of the body and is attached to the trunk by the neck. The anterior and posterior surfaces of the head combined are often referred to as the cephalic region, which comes from the Greek word for head. The head is a complex anatomical structure weighing up to 5 kilograms. It houses the brain and special sensory organs, so there is no arguing that it's a special, important, and vital part of us. If we move inferiorly just a little bit, we have the neck attaching the head to the trunk. It is also a part of the axial region and encompasses an anterior and a posterior surface. This region may also be called the cervical region. And similar to the head, the neck also contains many vital structures, such as airways and major blood vessels compressed into a relatively small area. It is sturdy enough to support a 5-kilogram weight 24/7, yet sufficiently mobile to move it in several directions. The neck is in continuity with the trunk, which is also known as the torso. The trunk of a human body is not unlike the trunk of a tree. The trunk of a tree is the main woody stem to which the branches and roots are attached. Similarly, the human trunk is the central bulky part of the body to which the neck with the head and the limbs are connected. The trunk can be further divided into 4 subregions or parts. On the anterior aspect, we have the thorax, abdomen, and pelvis. On the posterior aspect, we have the back. Let's start with the first region of the interior aspect of the trunk. The thorax, also known as the thoracic region or the chest, is a region located between the neck and the abdomen. The word thorax has its origins in the ancient Greek and Latin, meaning breastplate. It includes the thoracic wall, composed mainly of bones and muscles, and the thoracic cavity. The thoracic cavity contains vital organs of the respiratory and cardiovascular systems, such as the heart and lungs, as well as various other internal structures. That explains why a penetrating wound to the thoracic region is potentially life-threatening. The abdomen or abdominal region is the body region located between the thorax and the pelvis. Similarly to the thorax, the abdomen also comprises a wall and a cavity. The costal margin and the xiphoid process are readily palpable and form the border between the abdominal wall and the thoracic wall. Pelvis, or the pelvic region, is the lower part of the trunk. It extends between the abdomen and the lower limbs, bounded by the bones of the pelvic girdle. It contains the pelvic cavity, which is continuous superiorly with the abdominal cavity. So as you can see, despite being described separately, the abdomen and pelvis are actually continuous with each other, making up the inferior part of the trunk. In fact, in some resources, the whole area is referred to as the abdominopelvic region. The thorax, abdomen, and pelvis are all regions of the anterior surface of the trunk. The posterior surface of the trunk only comprises one region, and that is the back, which is an area located between the neck and the buttocks. The back includes the vertebral column, or spine, which protects the spinal cord and several back muscles. The scapulae and its muscles forming the scapular region located at the posterior aspect of the trunk, but are actually classified as part of the upper limb. However, due to its location, we cover it in detail on our regions of the back video. Now that wraps up the axial region, so let's move on to the appendicular region. Appendicular means something relating to an appendage or limb. So it is no surprise that the appendicular region includes the upper and lower limbs. They are often referred to as the arms and legs, but as you'll learn today, that is not exactly accurate. First, we're going to take a look at the upper limb. The upper limb is fundamental for our daily functioning. It is a multi-jointed lever that is freely movable on the trunk at the shoulder. Its primary function is to maneuver the hand into positions where it can manipulate objects. Thanks to the upper limb, we are able to grip, write, lift, and throw, among many other movements. The upper limb is organized into several smaller regions: shoulder, arm, elbow, forearm, wrist, and hand. Each compartment has its own muscles as well as neurovascular supply. Now let's take a quick look at them one by one. Going from proximal to distal, the first region is the shoulder, which is the part that connects the upper limb to the trunk. It houses the shoulder joint, which is the most mobile joint in the body, enabling to position the upper limb in a wide range of positions. The next region is the arm. In a colloquial sense, the term arm refers to the whole upper limb. But in an anatomical sense, it's only the portion located between the shoulder and the elbow. It is the longest segment of the upper limb and extends around the humerus. The elbow is the small region of the upper limb that connects the arm to the forearm. You probably already know where it is. Most of us have hit our funny bone once or twice. Guilty. This region contains the elbow joint, which allows for the movements of the forearm. The forearm is the second longest segment of the upper limb. It extends between the elbow and wrist and overlies the radius and ulna. The forearm helps the shoulder, arm, and elbow in force application and precise placement of the hand in space. The wrist is the region that connects the forearm to the hand. This is also a small yet complex region where we find the wrist joint and the small carpal bones. The hand is the most distal part of the upper limb. It is a highly evolved structure with a unique ability to grasp items. Much of the importance of the hand centers around the pincer-like opposable action of the thumb, which enables the tip of the thumb to contact tips of other digits. That's actually what allows you to grab that much-needed cup of coffee, okay? The hand contains many smaller subdivisions, which you can learn all about in our video on the regions of the upper limb. Now that we've explored the different regions of the upper limb, it's time to move on a bit further down to the lower limb. While the upper limb has been shaped by evolution into a highly mobile part of the human body, in contrast, the lower limb has been developed for stability and locomotion. The lower limb also has several regions with their own boundaries and contents. These regions are the hip, gluteal region, thigh, knee, leg, ankle, and foot. Let's start looking into the subdivisions with the most proximal and lateral region known as the hip region. It is the area overlying the proximal part of the femur and, most importantly, the hip joint. The gluteal region, also known as the buttocks, belongs to the posterior surface of the lower limb and is located inferior to the lower back. It lies behind the pelvis and extends from the iliac crest of the bony pelvis to the gluteal fold. This is a highly muscular region and a great place to give intramuscular injections. Moving down the lower limb, the next region is the thigh, also known as the femoral region, because it contains most of the femur or thigh bone. The thigh is the most superior part of the free lower limb and lies between the gluteal and pelvic regions proximally and the knee region distally. The transition from the trunk to the free lower limb occurs abruptly in the inguinal region or groin. Posteriorly, the gluteal fold separates the gluteal and femoral regions. The knee region is located between the thigh and the leg and contains the knee joint. This joint is the largest and arguably the most biomechanically stressed joint in the body. Similar to the arm in the upper limb, the term leg is also used in common-day language to refer to the whole lower limb. However, anatomically speaking, the leg strictly means the portion of the lower limb located between the knee and the ankle. The leg includes most of the tibia or shin bone and fibula or calf bone. The ankle is the region connecting the leg to the foot. It accommodates the ankle joint, which allows for movements of the foot and acts as a shock absorber in gait. The foot is the most distal part of the lower limb and the last region we will cover today. It is a resilient structure that supports your body weight while standing, walking, running, or jumping. And that wraps up all the regions we wanted to cover in this video. The body is complex and many of these regions are further divided into smaller areas. If you feel ready to go a little deeper and dig into the specifics of this language of anatomy, check out our detailed videos on specific regions of the body. Now it's time to talk about practical applications of the regional anatomy approach. While there isn't a specific clinical condition for this topic, it's worth mentioning that the concepts discussed here are fundamental for clinical practice. It's important that healthcare professionals know the descriptive terms used for the regions of the body in order to precisely localize and diagnose different injuries and diseases. On the other hand, having a common language is also essential for clear and accurate communication between healthcare professionals. I'm sure you wouldn't want to be admitted for knee surgery and instead leave the hospital without your appendix, right? Alright guys, that's everything we wanted to teach you today. Before we finish up, let's recap what we learned. The entire body is divided into regions. Broadly speaking, there are two primary regions, the axial and the appendicular. The axial region includes the head, neck, and trunk, which in turn comprises the thorax, abdomen, and pelvis on the anterior surface, and the back on the posterior surface. The appendicular region refers to the upper and lower limbs or extremities, which are also divided into smaller parts. The upper limb is made up of the shoulder, arm, elbow, forearm, wrist, and hand. The lower limb is formed of the hip, gluteal region, thigh, knee, leg, ankle, and foot. Having a good grasp of these concepts is fundamental not only to facilitate anatomy learning, but also for efficient communication between healthcare professionals. That's all, folks. This is how we split up the body. Well, not literally. We hope you enjoyed this tutorial and see you next time.